can't call it a pharmacy. Next slide, please. So this program is really focused on two major issues. The first is uncontrolled diabetes. So individuals that have a higher A1C level, uncontrolled glucose levels. And then the second population is those that are food insecure, those that don't have enough food. And it's really where those two issues intersect that we're really trying to, address these issues and then get that diabetes under control, get them the food they need, and really solve both those problems at once. How the Foodplex works is it's like a food pantry style location. Patients are referred from, at least for the pilot program, patients would be referred from a Genesis clinic to the Foodplex program. They would be given once a week's worth of healthy food meant for diabetes patients, and then for themselves and their families, and they would come back once a week. And so we're hoping that these individuals who have uncontrolled diabetes get a free, steady supply of diabetic healthy food to hopefully control their A1C without medication, without any other outside help. These individuals might have, issues with transportation, they might have financial issues, they might have any number of issues like educational issues, lack of kitchen appliances to cook healthy food. And so by providing them with free, healthy food, we're hoping to tackle both food insecurity and uncontrolled diabetes. And so the patient flow is, there's a referral from either existing diabetes programs within Genesis or their primary care physician at Genesis. And this is just for the pilot program that we're trying to launch this year. Then patients enroll in the Foodplex program and they have access to that free healthy food, hopefully controlling their diabetes. There are similar programs across the country in other health systems. For instance, in Geisinger Health System, which is a large health system in Pennsylvania, they've implemented a very similar program to what we're trying to do, and they've seen a decrease in the average A1C level for these patients. They've seen a reduction in triglycerides, which is fats. They've seen a decrease in cholesterol, decrease in emergency department usage, and length of stay in the hospital. So a variety of different health benefits from this program that we've seen in other health systems that we've talked to. So just a brief description of where we are right now. We've identified a location. Genesis has a clinic in downtown Davenport on 3rd Street that we're planning to use for this food pantry-like location, the Foodplex. We're currently working on renovating that space to make it more accessible for patients, to make sure it's up to code with giving out food to patients. And we're working on staffing, we're working on funding, and securing a food source, since one of the huge parts of this is, if we don't have food, there's no way we can have a food pantry-like location, right? So, and then building up the infrastructure, such as referring patients from a clinic to the Foodplex, building that IT infrastructure, and just everything that goes along with it. So right now, the pilot, we're planning on enrolling about 40 patients in it, 40 to 50 patients the first few months. That includes them and their families, so about 120 to 130 individuals for the first 6 months. And we're hoping to launch by fall of this year. So right now, the operational goals, obviously we can't do this on our own, since we're not charging patients, we're not billing them, we're not asking anything of them besides just, please take this free food, please try to help yourselves, and then track their progress as they improve their quality of life, get the food they need. And so we're trying to build partnerships with other systems, other organizations, and one of those is the Riverbend Food Bank and other food pantries in the Quad Cities to become a food source donor for us in order to really get this program underway. Other goals that we have are other dietary services and classes, other health systems that have launched similar programs that had educational classes that teach enrollees about preparing healthy foods. The difference between high calorie, high glucose level foods versus healthy foods for diabetes and other conditions they might have. And so really building that educational aspect of the program and the patient health that goes along with it. And then of course tracking outcomes. This is a program where we want to make a lasting impact in the community. Hopefully not just the Quad Cities, but also spreading out to Clinton or to DeWitt and to other parts of Iowa. And so it's important that we have the right performance indicators, the right things that we're measuring, and really tracking that data for patients to see that they're steadily making improvement. And if they're not, then talking to those patients and those enrollees and seeing, are there any barriers? Is there anything that we can break down and really help them? And that's where the educational aspect also plays a larger role. And so the long-term vision beyond just the pilot program this year is we want to have multiple locations. So we're starting out in Davenport. That area would cover mostly Davenport, maybe part of Bettendorf, but it would be mostly in the Quad City region. But then building that out to DeWitt and to other communities, because there are diabetics across Iowa and Illinois, not just the Quad Cities. And so as a system, Genesis, we want to not only help those right next to the hospitals and clinics we have, but also, as far reaching as we can possibly get. And of course, getting sustained funding. We're not billing patients. We're not, talking to insurance and reimbursing and getting reimbursement from them. This is completely just from the foundation, from donations, from, private citizens who are trying to help better their community. And then, of course, the population health impact, which I've covered before. So really the crux of why we wanted to come and present here is to get your feedback on some specific initiatives that we're working on as we work to launch this program. And so, just as many speakers say there's no bad questions, there are no bad comments or suggestions, so just let it fly. But I wanted to go through these 6 major areas that we're focusing on and just get your feedback and advice on how we can proceed. So the first point, which is, I know DeWitt in particular, with the DeWitt Noon Lions, the referral center, you do a lot of things with healthy foods and providing foods to individuals who are food insecure. And so I just wanted to get a sense of what are the different sources of foods? Is it all just food drives, private donations? Is it retailers? Is it grocery stores? Is it farmers? Since that's something that we are also working with in our program through a food pantry or a food bank. But if that falls through, we'd like to get a better understanding of how does everyone here gather food that is donated.
So with the referral center, a lot of it is private donation from the community. We do receive meat donations from the local meat lockers. We also receive donations from Randy's and Quick Star of their day-old items. And then we have the Master Gardeners. They help us out a lot with, the end of summer, fruits and vegetables, but a lot of it is private donation. Okay.
Yeah, thank you so much. Yeah, we've been looking at a few different sources for foods if the food bank avenue doesn't work out. And so, this is something that we talk further about with the other Lions clubs. Assistance or more advice on how to approach those different food sources, whether they're farmers, whether they're retailers, since it's really the basis of how to get this program up and going. So thank you for that.
Excuse me.
Yeah.
There's a lot of service organizations will contribute also.
Okay.
If you reach out to them. I know like St. Joe's Church will have a list of things that go to referral center.
Really? Okay.
The Lions. We also contribute. I know those are few. There are probably others. Again, reach out to service organizations.
Okay. Yeah. Thank you so much for that suggestion.
Yeah, all the churches have.
Yeah.
Okay.
Yeah.
Churches are a good resource to reach out to. Okay.
Is the Master Gardeners, is that an organization or a club or a group? Or just?
It's an organization.
Yeah, it's an organization. We have a community garden here in DeWitt. This is only like the 3rd year, but last year, I can't remember, many pounds of produce were given to the referral center from, I think, the master gardeners doing that at the community garden we have here.
Wow, that's great.
It was so large, I produce a large garden as well, and I took tomatoes and stuff over there, and
Yes.
they have a small area, they couldn't take them all. So I have a contact in Clinton, so I took probably at least a bushel a week between tomatoes, cucumbers, peppers, squash, and so on, down to Mercy Hospital in Clinton. And I got a nice letter from the director down there thanking me because all the employees exit door, they got fresh vegetables and they left.
Wow. From the referral center, when you receive those large donations, let's say they're seasonal, like what you were describing, is there any way that you preserve some of those and distribute them out later in the year, like canning efforts or anything similar to that?
So right now in our current location, it's very, very small. But we have a new building that is currently a month or so out from us moving into. So we will have a larger space, and where we also intend to have someone come in and teach us how to can. And things for our clients as well, to have classes on how to do these things and eat healthier with
Great,
our
thank
fresh
you.
vegetables.
Thanks.
So your summer lunchbox program
Yes, sir.
is a combination of food and vouchers, right?
Correct.
So tell us about that. Because that's where the families actually get a voucher that's funded by charitable organizations they can take to the grocery store.
Correct. So with each week they get, I'm sorry. Each week they get a brown bag, and it has kid-friendly items in it, healthy kid-friendly items, granola bars, your bread, your cereal, so on and so forth. Then there's a voucher for $6 for fresh meat or fresh lunch meat and cheese. And then there's also a $6 voucher for the farmer's market. And each week in a gallon of milk.
I was gonna say milk,
So,
yeah.
yep.
Wow.
And that's sponsored by our churches. I think there's 4 or 6 churches that sponsor that.
That's nice too, because then you don't have to store the cold stuff, and it's not expiring.
Right.
Do the vouchers expire though? Like, do they have to use it within that week? Or?
No, actually, the vouchers are all good. A lot of them they collect all summer long, and they go buy the actual things that they really want. So I think it will expire towards September.
And the idea there is that when school's out of session, some kids don't have as healthy of food options.
Right.
So that supplements that problem.
True.
And it's nice because it's not just for our clients' children, it's for the whole community. If you have a child in the DeWitt Central Community School District, then you're welcome to sign up for this lunch bag, and it's weekly. It's not just once a month.
And that's called the summer box lunch program, right?
Yeah.
How many meals do they get? Is the amount of food that they would get, would it last multiple days or?
Multiple days.
Okay.
Because they also get a loaf of bread with that
Right.
too, the peanut butter, the jelly. This year we added ramen noodles versus tomato or chicken noodle soup. So it's, I would say a good 4 or 5 days.
Right.
And then
Okay.
double up if your family's bigger.
Right.
It's just something to kind of subsidize, while parents are at work, the kids are able to make these things.
Yeah, I'm really glad you share that. We hadn't looked at any voucher system so far. The Foodplex would just be a food pantry-like location where patients or enrollees would come in and pick whatever healthy food they wanted and then leave with that week's worth of food. So it's nice to see that alternative. So I guess moving on to number 2, there are a lot of other similar, food associated, programs to help individuals besides just providing food. For instance, providing, kitchen, cooking equipment or recipe cards or educational materials, things like that. I just wanted to get a sense of, whether some of those programs already exist at the different Lions clubs or the referral center. or any other organizations that all of you are a part of. Since I personally don't have a lot of experience with this, and so just getting an idea of what other types of assistance materials are available, food related, it would all be a great help.
So we have members, I don't know if any are present today, that do the Milestones meal deliveries. Jane, are you still doing that? And Sally, you guys want to talk a little bit about Milestones? Okay, it's like Meals on Wheels, I guess, for lack of a better, it delivers.
St. Ambrose, I think, is, and so yeah, like Eldridge does. So the food is prepared and then brought to our community center, and then we have volunteers who deliver it to the homes of the residents who sign up for it.
Is it just like boxed lunches, or is it
It's,
what type of food is it?
they get a hot meal, and then they get like maybe 1 or 2 frozen meals
Oh.
to get them over the weekend or whatever the case may be. So, and they can sign up, you know, to get it 1 or 2 times a week or whatever the situation might be for that particular household. So, yeah,
Okay.
but they do get an actual hot meal or a cold meal, and then a couple of frozen. Yeah. St. Ambrose prepares it, brings it to the community center, and that's where they box it up, because they make it in the big, you know, containers, and then they individually package it for the residents.
Meals on Wheels is through the hospital. So there's 2 programs, two different programs in DeWitt.
Okay. Are there any sort of educational programs around healthy eating currently out there that anyone knows of? No, whether it's, you know, in, you know, not just DeWitt, but, you know, in other parts of Iowa. All right, going on to number 3. So, not just food related, but there are complementary services that go along with food, whether that's, you know, transportation. You know, these individuals might have transportation issues. They might, you know, need personal hygiene products. I just wanted to get a sense on what sort of programs out there exist that provide assistance, you know, other social determinants of health that are addressed through all the great work that you guys do.
The VA has sources that, I don't know that they run any of it, but that they refer to veterans, I know, out of the Davenport VA clinic.
Mm-hmm.
They have some health classes and things that they
Right,
do. And I know that they do referrals to food banks for some of the veterans.
I think some of the opportunities we're looking at for partnership in general and sort of you know, complementary programs is if a person is in need and they're coming into this Foodplex service, is there other things that we can also have available there? Maybe hygiene-based products, toothbrushes, deodorant, etc., toilet paper. The other things that we sort of, you know, we don't want to necessarily overlook that these people could also be, you know, benefiting from too, that we could just set up a small area to have some of those as a complementary resource for them to access while they're there. So I think we're just trying to discuss what opportunities might exist and what those things you all as a community think would be the things we should have there.
I know that North Scott High School has like hygiene kits for the kids if they, you know, come to school and they don't have them at home or run out. So it is available.
Okay.
So, but obviously that's only when school's in session.
So the referral center, we also have a section for our clients with all of their hygiene products, even laundry soap. They get to choose, you know, sensitivities, you know, the smells or whatever. That would be a great idea. A lot of people lose hope and then lose sight of their hygiene as well. You know, the saying goes, you know, if you do good, you feel good, and also if you smell good, you feel good. So yeah, that would definitely be something you guys could look into.
Thank you.
Yeah, thank you. So going on to number 4, This is something that we haven't implemented yet, but of course, tracking data from people who are enrolled is very important. But since many of them are going to be patients, it's important that the data is very confidential and it doesn't get out. You know, we can't just store it on an Excel file on a personal computer or anything like that. So this question might be more for the Lions Club or the referral center, but I'd open it up to just about everyone. In any current program, whether it be like with vision or healthy foods or whatever you're trying to, you know, any program where people come in, they get something and they leave, do you track that data? And anyhow, are those people's names, you know, on a database, or we're just trying to get a sense of what's the best way to track all those individuals in the program, track their data, besides just using an electronic health record that health systems use.
So up until September, the referral center, everything was on paper.
Okay.
We're now implementing, putting it on the computer. One thing that I did notice, and while doing some of the grant write-up, is a lot of places want to know all of the metrics.
Right.
We do not store those at all. We don't ask, we don't write it down.
Okay.
You know, but you guys are going to be on a much larger level, so you know it's always nice to have that hard paper copy too.
Right. Yeah. I've noticed the same thing. Any grant applications, they're always asking for those metrics.
Right.
Yep.
And I know with the milestone delivery, there's a tracking sheet that I'm sure St. Ambrose takes care of all of it, but, you know, if I'm a deliverer, there's a sheet for each household, and if there's like a husband and wife, there's a separate sheet for each one of them, and we have to sign off on the date that we're delivering it, so that they have tracking of how many meals go out and who's getting it and stuff like that. But I'm sure that's all, we don't have to do anything with it as the Lions Club, but I'm sure that Ambrose keeps that.
Okay.
You can definitely reach out to Ambrose and find out about that, what metrics they specifically use.
All right. Thank you. And then number 5 is advice on staffing. So the reason why I bring this up is because you know, anyone who's staffing the Foodplex, that's all going to be subsidized income since we're not asking for reimbursement. It's all going to be funded through donations. And so right now we're looking at how many people should we employ and staff to run this versus how many volunteers should we have. We've already looked at St. Ambrose asking, you know, putting in an application for an intern position to help work the Foodplex. And so, you know, this would probably be a question for existing food pantries and food banks out there. You know, maybe it's a question for the referral center. But, you know, how many employed staff are there versus volunteers? Since the current model we're looking at, you know, 1 employee and the rest would be volunteers. Is that something that would be feasible? Just getting your insight.
My personal opinion, you would need 2 employees because that 1 employee is not going to be there every single day. And you need that backup. We in a small one, there's 5 employees, but we all take turns, you know, pretty much in the pantry versus the thrift store. We're an all-in-one shop over here. But that is my personal opinion, and you will always have people that want to volunteer.
Right.
It's just getting, you know, it's not getting them to sign up for it, it's getting them to actually show up and come for it.
Okay. Yeah, thank you. That's a great insight. And then I guess the last point I wanted to discuss is, so as our pilot expands beyond next year, you know, all of you have deep ties to the DeWitt community, and so hopefully we'll be able to come back here in the future once the pilot's up and running, and then maybe ask for helping with scouting for locations. If there's a location in DeWitt where we could set up another one of these foodplexes to just provide help to diabetic patients and food insecure patients. And so that's something I just wanted to put out there for the future, that, you know, help would be appreciated in you know, finding locations, really understanding, you know, where in DeWitt the greatest need would be, and then good locations. So this isn't something that I need an answer for right now, but just, you know, in the future, hopefully we can work together, and it would be a great opportunity to bring another service to DeWitt. So with that, if there's any other comments or questions, you know, I'd be happy to talk about this for as long as you wanted, but thank you so much for listening.
Thank you.